Hello and good evening. My name's Tracey and I'm one of the Dengie nutrition team, and I would like to extend a very warm welcome to this evening's webinar titled The Latest on EMS, PPID and Laminitis in conjunction with Liphook Equine Hospital. This evening session is being recorded, and so if you're unable to stay to the end, you will receive an email in a couple of days with a link to watch the recording. The plan for this evening is that Jamie from Liphook Equine Hospital will speak first, and then I will follow on with my presentation afterwards. Then we will endeavour to answer as many of your questions as we can prior to 9 p.m. in a Q&A session. If I can ask you to pop any questions that you have in the Q&A function, that means that if we can't get to them all this evening, then we will be able to get to them and speak to you afterwards. So without further ado, I would like to introduce Jamie Prutton from Liphook Equine Hospital. Jamie undertook a bachelor's in veterinary pathology at the Royal Veterinary College as an intercalculated degree during his veterinary degree at the University of Liverpool. Upon graduation, he started working at a mixed large animal clinic in Yorkshire. Following a year and a half in this role, he started an internship at Rochdale's Equine Hospital in Suffolk. While there, he became interested in equine internal medicine, and after the internship moved to California to start an internal medicine residency at the Medical Teaching Hospital, University of California, Davis. He gained diplomat status from the American College of Veterinary Internal Medicine in July 2015. His interests beyond internal medicine lie with cardiology, neurology, and GI disease. And all I can say to that, Jamie, is wow. So if you'd like to turn your camera on and come and introduce yourself and start sharing your screen, I will turn myself off.
Thank you very much for the introduction, and we should hopefully be sharing now. I think that's a life misspent doing too much academics rather than anything else, but thank you for everything. And it was lovely to see the alfalfa. It reminds me of being in California because it was obviously everywhere when I was there. Today I'm going to be talking about EMS, PPID and laminitis, and hopefully bring it all together to explain how everything links together and what we can hopefully do to try and stop it occurring. So the first question I think that we really need to understand, or the only question really, is a fit horse and a fat pony are turned out to grass. The pony gets laminitis and the horse doesn't. Why? So hopefully throughout this talk, I'm going to come to some conclusions that can at least guide you in your treatment of those patients. I'm going to do a very brief introduction on laminitis. I think, to be honest, the pathology and things like that are not necessary for tonight, but there has been a bit of a fundamental rethink in how we look at laminitis as a disease process. I'm then going to go into both EMS, so equine metabolic syndrome, and PPID or Cushing's disease. And in each topic, I'm going to look at what the relevance of that disease is in relation to laminitis, how we diagnose that disease, and how we fundamentally treat it. And then there'll be some time for question after Tracey's had a chat. Throughout the lecture, there will be little speech bubbles around, which are questions that have been kindly asked by some of you guys who are viewing this right now. So hopefully I'm going to hit a few of those as we go through. With regard to laminitis, I think we're all very, very aware of the stereotypical clinical signs: the single to multi-limb lameness, the sawhorse stance, increased digital pulses, reluctance to move, sensitivity to hoof testers. All of those clinical symptoms we're at that latter stage when that horse has truly got laminitis. And what we're talking about is the lamellae, those sort of Velcro-like attachments between the hoof capsule and the pedal bone, have not only started to stretch and started to pull apart, but where we start to get that sawhorse stance, the real severe disease, it's likely that they're starting to separate and rupture. And as that happens, that becomes more and more difficult to treat, and we start having to get into the more intensive management of that case. So rightly, somebody asked, what are the early signs an owner should be looking for to try and reduce the chance of that horse going down that progression route? The first and the easiest thing is changes in the hoof architecture. So divergent rings are a sign that some insult has occurred at the coronary band as it's growing, and so you get these little lumps and bumps. As that progresses, separated white line disease or flat and even convex soles in the more extreme cases. And sometimes it can be just that you're aware that your horse is a little bit pottery and not so certain. And if that's the case, then get your vet out sooner rather than later, because as we'll show, it's much easier to treat these things early rather than it is later. And what we're looking at is a fundamental rethink in the last sort of 5 years, actually, about how laminitis is caused. And there's been a paradigm shift in how vets treat and deal with this disease over the last decade, really. And what we've learned is that this is a clinical syndrome associated with a systemic disease, rather than it being a standalone disease of the foot. In other words, laminitis is frequently occurring because something else is happening in the body. And in the vast majority of cases, that is because of endocrinological disease, such as Cushing's or PPID. And there is this new body of evidence that says there's a change to the cellular disease process that's going on in that cell, in the hoof. And what that means is that as those early stages of laminitis occur, and I'm talking again about the lamellae that are a little Velcro patch, those cells start to stretch. And as they stretch, there is an ability for us to stop that stretching, moving to the next stage. And the next stage is as those cells tear and rupture, and you get that unzipping of the Velcro. If we can catch disease in that early subclinical phase where we're getting the stretching of the cells, then we can fix these and we can stop it happening again. So early catching from your part is absolutely essential. But what causes laminitis? There are 3 big groups that we often talk about. One is endocrine hormonal disease, one is mechanical traumatic disease, and one is toxic. Within the hormonal disease, we have 2 main categories, equine metabolic syndrome and equine Cushing's disease. And we'll go through both of those specifically. The third one is glucocorticoid or steroid administration. And I think that topic is one that is contentious at the best of times, but often it's occurring once steroids are given for some sort of disease, whether it's into a joint or orally. You see laminitis because there is something else underlying, some EMS or some Cushing's. Mechanical or traumatic, road found are very American, but that's concussive repetitive force on the hoof when it's not appropriately shod or it's very hard ground, or excessive weight bearing on the other limb. So in other words, whenever that horse may have a fracture, for example, or some hoof injury, they'll put a lot more weight through the opposite leg, and that can cause laminitis. And finally, infectious diseases such as colitis, retained placentas, pneumonia can induce laminitis. And there's a model called a black walnut model as well. I'm only going to be talking about EMS and PPID today. The others are not within this lecture at all. There we go. So what actually causes laminitis? We know for a fact that insulin is central in the cause of laminitis, but insulin is an essential part of our body. And insulin is released into the circulation after eating. So you consume some food, your blood sugar levels go up, the body releases insulin, and that allows movement of that sugar from the blood and into the cells. And then normal blood sugar is maintained. But what we see is that there are a number of reasons why insulin may become high, and that can be because a horse has an abnormal response to food, so they produce far too much insulin. Or it might be that the insulin receptors at the cell level, so in that sort of blue circle, they're not working. So you give it insulin and they don't respond. And so they don't move sugar out, and then they produce more insulin to try and get it under control, very akin to diabetes in humans. And if there was a third one, I'll come back to it when my brain gets there. Sorry about that. But what we know is that if that insulin level is sustained in horses at a prolonged period or just for short repetitive periods, what we see is that they develop laminitis. And that has been proven in multiple studies. So when we think about the world in general, actually, and particularly we can relate this to our equine population, what is the greatest risk to health? And maybe we can slightly argue this, actually I don't think we can realistically with COVID going on, but what we know is that the biggest risk to health is obesity. There has been this massive trend in obesity increasing throughout the world in humans, and that's partly because of high sugar and fat consumption and less exercise. And what we see is actually in horses, this is completely the same. We're seeing this massive increase in obesity throughout our equine population, and that is partly due to our intensive lifestyle that we give them now. So they're kept inside all of the time, they're fed high energy foods, always sustained throughout the winter. And also a lot of them are getting much less exercise than they were before. So how does that play into what we're talking about today? Equine metabolic syndrome is a collection of risk factors that are going to increase the risk of laminitis. And those are insulin dysregulation, obesity, and adipokine dysregulation. Insulin dysregulation can be caused purely by obesity. So your fat horse is going to have abnormal levels or abnormal fat, that is metabolically unusual. And what that does is it produces those abnormal fat cells produce less adipokine, particularly a few in particular, which I'll come on to, which then increases the insulin resistance in the body. So insulin dysregulation can be purely an obesity problem. It can also be secondary to PPID. So we can see that some of these horses have diabetes-style insulin dysregulation because of PPID. But what we know is that around 70% of the horses in the UK are overweight to some degree. And so what's the point? I can tell you that the vast majority of them will have some degree of insulin dysregulation. But what's important is that not all of them have the same degree of it. And so by testing, we can let you know what the laminitis risk is. We can also monitor a baseline. So as we diet them, we try and improve their lifestyle. We can follow how they do. But it's really important that we are aware of any limitations of those tests, which we'll go through in a moment. So, but what is metabolic syndrome in humans? Because I think it's important because some of the drugs that we use come from the human medicine field. So it's important to understand humans as well. And what it is it's a collection of factors indicating increased risk of heart disease and type 2 diabetes. So we don't get heart disease in horses, we get laminitis instead. We don't get true type 2 diabetes because there's a difference in the way that things fail, but essentially it is the same. And what it is that there's a loss of normal insulin glucose regulation. There is obesity, whether it's generalized or just regional. I think that's really critical when you are monitoring horses' weight. But just because they're a bit skinny over the ribs, they may still have a lot of love in their handles or in their neck as well. So just, be aware of that. High blood pressure, not so important in horses, but an abnormal blood fat profile as well. So there's massive correlations between the two. And what we know is that a rich diet that's sugary, increases body fat, and decreased exercise will disturb that regulation. And that leads to higher and higher levels of blood insulin and also high levels of glucose, both of which, or particularly the insulin, leads to laminitis. So we go back to our fundamental question. A fit horse and a fat pony are turned out at grass. The pony gets laminitis and the horse doesn't, but why? And I think what we can say is there's a multitude of factors involved in this, and we're not talking about PPID, we'll come on to that. But what we know is that excessive insulin levels trigger laminitis, so likely the pony has excessive insulin levels. What it might be is that the pony doesn't respond to insulin appropriately, and that could be because it's not producing the right hormone regulation from its fat. The pony may secrete more insulin because it's eating grass when it eats grass, and the pony may have PPID. So from that, we can start to untangle. We may not have the exact diagnosis, but we can start untangling how we're going to fix this problem. And what we know is that insulin response differs in laminitis-prone ponies. So a group compared insulin responses to feeding in 12 normal horses versus 8 fat ponies. And what they did is they fed a hay and rice bran diet and then one with glucose. And what they found was that the fat ponies who were prone to laminitis showed an excessive insulin response when the high sugar diet was given. So as we can see in the graph on the right-hand side, horses, blue being the normal diet, orange being with the glucose, they had a small increase in the insulin, which is absolutely expected because we're giving more sugar. Whereas the ponies had that dramatic insulin level. And what we know is anything sort of about 150 that's sustained in the micromoles per litre will lead to laminitis. So when you're looking at 400, these horses are going to be prone. Another study looked at 37 ponies, fed high sugar diets. And following through that, they measured all the insulin responses. And what they could see is that the responses varied between the ponies dramatically. But 14 out of them developed laminitis. What they found, though, was that those with higher insulins were more likely to develop laminitis. So we can see in this graph that 67% of those in the highest category developed laminitis. But also, those with the highest insulin developed laminitis the earlier. earliest. In other words, the insult was so severe that it happened very, very fast and you missed the subclinical phase. So hopefully what I've proved through this conversation so far is that Cushing's is one thing that we're going to come on to in a moment. But what we know is that a rich diet, grass, feeds, whatever it might be, leads to more insulin released. It might be that that insulin isn't well used or that it's just consistently released. Those horses may also be efficient absorbers of sugar, but what it all means is there's an excessive insulin release and laminitis. So how do we test for this? I think there are a multitude of tests, and it can make it very, very complicated. And so hopefully we're going to break this down a little bit into some easy bite-sized chunks. There's some basal insulin testing. In other words, we take one blood sample at one time point, and that tells us what is going on at that moment in time. That can be after a fasted sample. So in other words, we starve the horse overnight. The problem with that is that it's highly likely to get a false negative. A false negative is when the horse actually has the disease, but the test is saying it doesn't. And that's because a lot of these horses respond abnormally to the food they're given, rather than it being a constant level of hyperinsulinemia. So we don't do the fasted anymore at all. Resting is when you feed as usual, and then you test the insulin approximately 2 hours after the feeding. And I think this plays a significant role when we start looking at how we can move forward. But as a primary diagnostic to tell you whether or not your horse has EMS, this is not a very good test on its own. So how can we advance our knowledge on this then? There are two in-feed glucose challenges that we can do. And what's important is you either starve your horse or you give a small feed about 10 p.m. so they're pretty much starved by the time we get round to doing the test. You can do Carolite, which is a sugar syrup from America. They use it in baking. And you give about 45 mils per 100 kilograms, syringe it into their mouth, ideally warm it up in the microwave with a bit of warm water, makes it a lot easier. And then you test, or your vet comes out and tests the blood 75 minutes later. There is one that some people prefer, which is a glucose absorption. So you just give glucose in the feed and then test 2 hours later. What we know is that both of these tests, but particularly the Carolite, allow us to see a much more sensitive and specific result. So in other words, we are going to pick up far more of these horses at EMS than if you do the others. And I think one of the questions that was asked is, should we be performing these regularly? And the answer is absolutely. I think it's a really good way of monitoring as we go forward, whether or not our diet, our medications, whatever it might be, are really fixing the problem or not. So one-off will get you the diagnosis and then repeat it as the horse is losing weight. I never set a time when I ask for these things because otherwise the horse may not have lost enough weight during that period. But I would recommend once we feel confident the horse has lost weight, then we can start doing the test again. The final one is this adipokines that I've talked about. This brings into the genetic side of things. We have been testing adiponectin for quite a long time. It's a molecule that's produced by fat, by metabolically normal fat, and it increases insulin sensitivity and also reduces inflammation throughout the whole body. And what's really important about that is that it's actually going to allow the body to work far better than it was previously. And what we've found as we've moved forward with this is that we seem to have two groups of horses, those that respond very well to a diet and their adiponectin massively improves very quickly. Then there's a group, normally your native horses, your New Forest, your Shetlands, whatever it might be, that however much weight they lose, their adiponectin doesn't respond in the way we were expecting. And I think that's a reflection of the genetic component to this disease process, that actually some horses are prone to be ready for starvation. They live in poor quality areas of food, so they're going to try and squirrel away as much as they possibly can into their body. Adiponectin's advantage, though, so it's not always a great monitoring tool, but its big advantage is that it's unaffected by stress. So if your horse is laminitic currently, it doesn't really matter. We don't have to worry. We don't have to give the horse anything. It is, though, only a proxy marker for equine metabolic syndrome. In other words, it's only giving you a guide and saying it is likely to have EMS, not that it definitely does. But when used in conjunction with the other tests as we move forward, it's a fantastic armory to our tool of diagnostics. So how do we interpret the results of another one of the questions? Fasted insulin, there are no result parameters, so that's why we really don't recommend it. Resting insulin, we're looking at a 0 to 32 range. What I would say is that if a normal horse, thoroughbred horse, should be sitting around 0 to 2 most of the time, really, really low levels of insulin. And if you start to see higher levels, you're starting to sit in the 30s, you start to question it as the vet and say, okay, that resting is a bit controversial. I think we should move on to the next test and then get that carolyte insulin or the glucose done. And the values for the post-carolyte and glucose are there. And as I mentioned, the carolyte is the more sensitive of the two, although sometimes it does fail. And sometimes we have to go back to the drawing board and do the post-glucose insulin. And finally, the average should be a high value. So just if you get a bit confused, that one is meant to be very high rather than low. What's really important is when we look at these values, if you take these values away tonight and mull them over, is that these values are specific for the laboratory at Liphook Equine Hospital. They are not the ones that may be used by other labs. And that's because we, in correlation with the RBC, have created the carolyte insulin test, and therefore we have our set ones for those. And adiponectin was one that we worked at Liphook Equine Hospital as well. And so we were the ones who first created those tests. And the potential new testing, so I mentioned earlier about the resting and looking at food and what might be occurring. And I think this really is something that we need to be doing as we move forward. What we know is that various different foods can induce hyperinsulinemia, but that isn't consistent between every single horse. So one horse may respond to food A dramatically, whilst another horse responds to food B. And also what we know is that some horses have prolonged hyperinsulinemia, most likely secondary to PPID, whereas others have these spikes. And so it might be that actually if we can tailor our diets, tailor what we're giving, that we might be able to reduce those hyperinsulinemic spikes and therefore reduce the effect. So what we're now quite often doing is once we have a diagnosis, once we've got a horse that's doing quite well with its weight, is that we start looking at each food individually. And by that, I mean that we starve the horse overnight, we give the food, and then about 2 hours later, we test the blood for the insulin levels. We can also then extrapolate that longer into the 6 hours if we're worried about these horses being hyperinsulinemic over a prolonged period. But I think this is something that we're really starting to get a handle on, and actually is really critical if you can work with your vet and are willing to sort of undertake that repeated testing. We can give you a really good indication on how we can move forward. And I think this is critical to some of those questions that people have asked of, can my horse ever go back out to graze? And the answer is hopefully yes, we'll get you there. But we should be certain that when we do turn them out, they are safe. Because the worst thing is that if you get the weight off, you fix the laminitis, we turn them out and we don't test them, and suddenly they get laminitis again. So this new style of testing is going to really give you that information. Now, one thing when we look forward at all of this is, do you think your horse is fat? And be honest, whilst you're all sat there thinking about it, do you honestly think your horse is fat? And the reason I say that is there was a study done looking at about 160 horses where vets went out and body condition scored them. 21% of those owners in that group said their horse was overweight. 54 were clinically overweight. And what we know is actually even more, as I said earlier, about 70% of horses would be classified as overweight. Now, obviously that varies between slightly overweight to morbidly obese, but it's all in that category and increasing the risk. And there's a good deal of denial. My horse is a good doing type. He eats nothing, he lives on fresh air, puts on weight when he looks at grass. I couldn't feed him any less. All of these are very true statements. These horses are good doers. They do easily absorb their energy and utilize it. And that is absolutely true. But it means that we have to adjust our lifestyle, our grazing, to fit with them. And I think what's really important is, how do we do that? How do you do that when you are at home? Because we can do that with a weighbridge, which is fantastic. And I think that is critical when you have a very difficult case, is to utilize the weighbridge, whether that's your vet, whether there's lots of nutritionists out there, there's also lots of feed companies who will come and weigh horses on a regular basis for you. But we can be a bit more subjective. We can do a general visual assessment, prone to problems. We can do a body condition score. So there's one called the Henneke scale, which is on the Blue Cross website. And that's a very good way, basic way of doing it, but it does limit your ability to be precise. There are some others, Cresty Neck score, which is a very good way of measuring the neck at various different points, and you can measure it compared to the height of the horse, and it gives you a good idea as to whether your horse is fat or not. And that's what's important, is recognizing where fat is stored in the horse. It's stored not only over the ribs, but behind the shoulders, over the crest and over the tail. And those areas are sites you've got to really look at. And one question is, what do we do when insulin levels are high, but the horse is thin? And the question is, are they truly thin? I'm sorry to whoever asked this, but the fundamental question is, are they truly thin? What are they on the body condition score scale? And the second question is, do they still just actually have regional adiposity? So they may be very skinny, but they may still have neck fat, and they may have abdominal fat, both of which are the most metabolically abnormal fats. And until we get those resolved through exercise, through ongoing dieting, and exercise is critical, then we're not going to regain that. So therefore, can laminitis risk be controlled? And the answer is yes, absolutely. And there are two choices that you fundamentally have. One is that you accept there is a problem and you deal with it. You get the weight loss, you get the PPID, whatever it is, under control. The other is that we accept that laminitis is something that's going to occur to that horse. And at some point, it might be so severe that the horse dies prematurely from laminitis. And I know that's a bit of a scare sentence, but it's true. I see enough horses that die because of laminitis that could have been treated earlier. And one question was, following a long history of laminitis, how do I manage my horse, and is it going to restrict her forever? And we're going to go through these management steps now on weight, but the fundamental thing is that hopefully we can return them to some degree of normality. So how to restrict dietary intake when grazing? It's not possible. Grazing is absolutely fantastic. Grass is brilliant. It has all the nutritions. Realistically, a horse on grass doesn't need a single thing extra if the grass is in good nick. But what it means is that ponies can eat nearly their whole total daily requirements in 3 hours of grazing, which, if you then think I'm going to feed the horse for another 21 hours, suddenly they're getting a lot of food. Muzzles can play a really significant role in these cases. Although they're not perfect, they will reduce the grazing by about 20 to 83%. And somebody asked, is it fair to put them on horses? And I think the answer is yes, as long as the sward length, the length of the grass, is enough that it will poke through the muzzle. Obviously, there's multiple water buckets that are big enough that they can put their face in. And checking for any sores, anything like that might occur. So lots of these, you get nice sheepskin attachments to them to keep them comfortable. But yes, they do seem cruel, but actually horses get very much used to them and work around them. And it's amazing what they can eat whilst they've got one on. Sometimes, though, dry locked turnout pens are required. So how do we prolong a feeding period as well? So lots of these horses are going to become very, very angry by the fact that they're suddenly being starved and their food's being taken away. So we can do fine weave hay nets, we can do double, triple netting. You can even put the hay net in the center of the stable so it swings, or sometimes I'll put them at the back of the stable so that they go and eat and then they come and look over the stable door to watch the world go and eat, watch the stable door. And as I mentioned, exercise is absolutely essential to getting these horses right. You can be skinny but unhealthy. So that's true of us, that's true of horses. So without the exercise, how do we expect our metabolic position to improve if we're not trying to change that fat to a more metabolically active fat? There are a couple of ways, though, that we can increase exercise. One is one that doesn't involve you too much, and that's, I often use, I sometimes recommend pedometers can be put on these horses. And what we can do is then we can test different things. And I found with one horse that it was turned out in the school. And by putting the water in one corner, the food in another corner, and the view to the other horses in another one, they walked so much more than if you put the food in one place. And suddenly these horses were walking a lot of steps every single day. This is obviously only true when laminitis isn't occurring, and you just have to do the diet without laminitis, when it's laminitis without exercise. But exercise is critical, and there's some really good studies showing that you have to do it and you have to do it properly. So you're talking 15, 20 minutes of walk, trot, canter, really pushing that horse to get fit and working hard. So ideally 15 to 20 minutes of solid trot, and then as they get fitter, obviously you bring in canter. So it shouldn't just be a 15-minute hack. As I said, weigh bridges are fantastic. I think they're the way forward so that we know that we are getting the weight off the horse. If you are going to use a weight tape, it's important to do it in the same place, and also to look away as you tighten it. So tighten it, cinch it around the same place, look away so you don't know what you're going to get. It's amazing how you can lift another 10 kilos off with a slight tightening of it. Reassess every 1 to 2 months. When I'm dealing with these really critical laminitics, I like to see them every month. And what we're expecting is about a percentage body weight loss per week. It can be between 0.5 and 2%, but if we're going up to the high levels, we start to worry about some negative effects of the weight loss. So in a 500 kilo horse, you're looking at a 5 kilo loss per week, so 20 kilos per month. If you're not achieving the goals, you've got to reassess the food intake. And the first thing to look at, as I mentioned, is pasture and to stop the turnout. So when we look at food, and Tracey's very much going to go into this more than I am, I'm going to do a very brief Mickey Mouse version, which is what I use because most of the time it works, but she's got a lot more input into this. I think it's very good to break this down simply. Hay, start with hay. We're going to weigh this out in a second. I'll show you that in a moment. Soak it, and you've got to soak it for a relatively long time, 6 to 12 hours, but make sure you don't do that in the summer when it's going to ensilage and become sour tasting and not very nice. You can add a chaff if you need to, if the horses are being fed around it and you just need to calm it, or you need to give it medications. And then a feed balancer. So somebody was asking about what vitamins and minerals are required if hay is soaked. And I just use a basic low-calorie feed balancer. What's important in all of those foods is that they are unmolasted, they are low sugar and starch, less than 12%, and that they're not going to get grass and they're not going to get straw bedding. When we look at the diet, what exactly recommendations we make, we normally recommend some sort of percentage body weight of a diet. 2% of a body weight of diet is going to maintain your horse at a relatively low level of exercise. So in other words, a 500 kilo horse needs about 10 kilos of food going via its lips every single day. When we start dieting, we normally start about 1.5% and then gradually decrease to 1.25, maybe 1% if we are really, really pushing our luck. You know, a severe laminitic that's on the end of life or death, really. And I think the really critical thing, I don't think I can push it enough, is that that number, whatever number we're talking about, 7.5 kilos in a 500 kilo horse, is literally everything that is passing that horse's lips. Remember to include the carrot, the feed balance, and the chaff, whatever it might be. And it's amazing how many people, when you actually start digging, are giving 5 supplements, which actually will add up to a kilo. And each supplement carries calorific content as well. So remember that as you work through this, that it really is critical. You are super strict on this and make sure nobody else is feeding them and put signs everywhere. So what pharmaceuticals can we use? One step back, diet is the number one. Most of my cases that come in with severely laminitic disease, we may add metformin as a little icing on the cake, but I have saved more horses than anything else by giving them a strict diet in the hospital where suddenly they start losing weight where they hadn't been before. And that is purely because we are able to watch and we are able to be unbelievably strict about it. But metformin in humans is this wonderful drug that helps with weight loss. In horses, it doesn't do that. It doesn't do it at all. What we know it does is it reduces glucose absorption and therefore flattens that insulin spike, which if we go back to the previous information, is the insulin is the problem. So actually it can help in these acute cases. The problem is that it's got poor bioavailability. So only about 4 to 7% of the drug that you give orally is actually getting into the blood. The rest is going out the back door. So it doesn't stop working per se. It just may never have worked very well. And so it really is just the adjunctive therapy rather than the sole therapy that we should be taking. And levothyroxine is something that's sort of becoming more and more of a norm. And in my opinion, it's something that we have to be very careful with. It's a really easy get out clause to not have to diet the horse properly. Because all it is a thyroid hormone that's going to increase your thyroid, increase the metabolic state, therefore burn off more energy. And unless you reduce the diet, you're not going to get the weight loss anyway. You may get a little bit, but it's not going to be all that much. And there are complications. You know, these horses lose their thyroid production for a while. So suddenly you take that drug away at some point, what do their thyroids do? Also, my experience has been that lots of these horses are suddenly stabled, they're expected to stand still, and actually they go a little bit crazy because they're hypothyroid and they're a bit wired, they're a bit dangerous. So be aware that actually, although it can be very helpful and it definitely does aid in weight loss, and I'm not questioning that, I think it has to be used cautiously. This graph just is a quick show of how well metformin can help in the horses. Blue line being a normal horse who's been given glucose, and then the red line is one that's been given glucose and metformin. And we can see that insulin spike is much, well, it's hardly a spike, it's just a plateau So it can be very helpful in those very acute states. But my important statement with metformin is always have an escape route. Make sure that we have a way of getting that horse off metformin so it doesn't stay on it for the rest of its life, because it doesn't need to be if we address the diet properly. And I've already mentioned the genetic predisposition with regards to the adipokine production in some of these native breeds, but also another group looked at the genetics of some horses with laminitis and those without laminitis. And they did this looking at some fat and also some white blood cells, and they assessed those types of cells in both the summer and winter. And what they found was that those with laminitis had about 58 to 192 genes that were different compared to the non-laminitics. And all of them were pretty much associated with inflammation, which is quite often the cause of laminitis. So we don't know what that means. We don't know what to do with that genetic information yet, but it's proving that there is a genetic component that makes these horses more likely to get laminitis. So that's hopefully a summary of EMS, the current status, where we're at with testing, and the importance of hyperinsulinemia and how it causes laminitis. So, equine PPID, or Cushing's disease, which is the pituitary pars intermedia dysfunction. What we know in these cases is that these horses have a gradual, mild enlargement and proliferation of the pars intermedia. The pituitary gland is a little gland sitting at the base of the brain, producing a vast, vast number of hormones and different peptides that have a number of different jobs in the blood. What we know is that this enlargement can become tumor development, can get bigger and bigger, and the longer we leave it, the poorer the prognosis or the poorer the response. But why has it become such a thing recently? You know, probably a decade when I first started, it wasn't that exciting. But what we've seen is that it's a disease risen from a minority interest to one that is one of the most commonly encountered diseases in equine practice. And that's because we are seeing and understanding this endocrinopathic laminitis far more. And so we know that PPID is involved. And also we're seeing a lot more geriatric healthcare. So a lot of these horses that would maybe have passed away before are now carrying on well into their 20s, 30s even. And the more cases we've tested, examined, follow up, the more questions are arising. So we're really, really at the infancy of all of this. But what's important is to think, when do we start treatment? What do we expect? When should we follow up? How should we follow up? And also what to do if we get a poor responder. I think if we just take one step back, sorry, I forgot to answer one question, is how is PPID linked with laminitis? And what we know is that PPID itself, if you take an ACTH value, which is the marker that we use on its own, it doesn't correlate with laminitis. It doesn't mean that there's an increased risk of laminitis. What it does mean is that there's more likely a propensity towards having a hyperinsulinemia and therefore laminitis. So it's a slight link to this insulin dysregulation. And so therefore it is absolutely critical, if it's there, that we control it. So what tests are available? There's a couple out there. First and foremost is the basal ACTH. This is the blood sample that we just take at one time in the day and we look for ACTH. And what we know is that it's fairly specific for PPID cases, but it's not always that good if you're in the grey area. So lovely if your horse is hairy, it's got laminitis, it's got recurrent infections, all the usual hallmarks of PPID. But if you're in the grey area, it's not so good. So we then recommend a TRH stimulation test, which is where your vet will inject TRH, which is a hormone, and then we'll measure the ACTH response following it. Also, we're going to look at basal insulin and post-glucose insulin. Just as we talked about insulin already, we don't need to go back there, but we know that these are correlated with laminitis and also correlated with PPID. So when we're testing, it's really important to consider a couple of things. One is that there is a seasonal range in just your basal, that one-stop shop ACTH. And we know in the autumn months when the light has got long and then it's starting to reduce, we see this massive spike in ACTH, and actually it's much, much worse for some certain breeds. So we're learning as we now go through Andy's research, this is thanks to Andy Durham, this bit, we're starting to see this breed differentiation since we've gone through 400,000 samples. So our advice may be different for a Shetland who's sitting at 140 versus a thoroughbred who's sitting at 140. So it's really important to consider that. And also when we're testing, we always recommend twice a year testing. And that should be once when we're in that baseline low level area from January to July, really December to July. And once also in the autumn period, so that we are making sure we've got absolute full control of them. I haven't put any reference values up because here at Liphook, we change that reference value on a weekly basis now that we have so much information. So there's no point in putting that all up. TRH is that next step. You've got a grey area horse that you're just not sure what to do with. And so you're going to reach for the TRH stimulation and have a look. And the reason there's this range of results is that whenever you get into that autumnal peak that I've already mentioned, you start to see a massive change in the TRH response. So I only really recommend the TRH testing in that quiet period from sort of December to about July, October time. So how do we treat PPID? I think most of you will be fully aware of pergolide. You know, Presend by Boehringer Ingelheim is the main treatment of choice at the moment. And that's very, very well evidence-based. We know that this drug is available and it works well in the majority of cases. And we normally start at a fairly mundane dose of 1 milligram, one tablet, sorry, for a 500 or kilo horse. If you're about 250 kilo horse, you start about half a tablet. But obviously you'll be guided by your vet on that. There are other treatments available. Cyproheptadine is one that there's plenty of clinical research out there about, but actually its response is very poor. But sometimes we will, as vets, add it in as an adjunctive therapy into your pergolide as well when there's a poor responder. There are these other drugs out there, which are, sorry, you don't need to worry about the doses, sorry, that carried over from a different talk. And then the Vitex Agnus is a hormonal supplement, a plant-based supplement, which I'll come on to in a second. But when do you start treating? That's a really good question. You know, do you start treating that subclinical horse that you just had that inkling? You thought, my horse isn't what it used to be. These things have changed. You get your vet out, you get an ACTH, and it's a bit borderline, it's a bit high. But then I would, I think that is a really good point to start doing it, because what you're looking at is, do we wait for all the other signs or not? What we know is that the vast majority of horses with PPID have laminitis. And so when we start to get clinical signs, we do worry that we're going to get the laminitis. It's the worst case scenario. The rest, who cares about? Bit of hairiness, we can clip it, whatever. Bit of lethargy, sometimes it's not so bad. Laminitis can be life-threatening. Sorry, it's not moving forward. There we go. So what are we going to do? How are we going to decide when to treat? And I think we have a few options here. Do we start at this bottom level before the laminitis has occurred, before the life-threatening disease associated with PPID and insulin dysregulation has occurred? Do we do it after the first bout of laminitis, after the second, or when the horse is hairy and drinking a lot? Often it may only be because one of these things has happened that we are alerted to the problem. But if we're astute and we're picking it up early in the subclinical phases, we might be able to get it in the green area. And it's nice to correlate this with something human so that we can think, okay, what do we do in a human? We know that HDL, low plasma HDL cholesterol, is a risk factor for heart disease. And sometimes we test humans for this, you know, whether they're prone to it genetically or whether they are, there's something changed in their life. Do we start treating them for that at that stage, or do we wait for them to have a heart attack, a second heart attack, a heart transplant? And the obvious answer is we start at the beginning. We get into a treatment as soon as we possibly can, because we're going to have the best success if we're going to stop the high cost, high risk disease occurring. And so we need to be doing that with our PPID, because it's going to stop that insulin level increasing and lead to laminitis. So let's get them whilst we can in that very, very early phase. The worst thing that it is it's expensive over a long period, and I completely understand that. But if we don't do it, a bout of laminitis, you know, the clinical bills for when they come into hospital can be thousands and thousands of pounds. And if they're dealt with at home, not much different. What's sometimes problematic is that the correct dose of pergolide can't always be predicted. So we need to then judge when it's been efficacious. And this can be judged on clinical improvement alone. You know, does the horse do well? Does its hair, attitude, PPID improve? A, it's subjective if we do that, and B, what we can see from this data from another study is that only by 180 days were about 90% of the horses who were being treated starting to show resolution of their hairiness. So you're talking half a year before you know that that's working. It's not really quite good enough. So we should be repeat blood testing them. And for when you first start treating, we always recommend a repeat blood sample at 1 month's time. And what that's going to see is that 91% of horses have responded by 4 weeks' time. And therefore, those that haven't responded may be in the small minority that are going to respond gradually, but over a bit longer. But more likely, it's one of the ones that is not going to respond and therefore needs a dose increase. If that occurs, then you need to retest again a month after the dose increase. Otherwise, we normally recommend going to about a 6-monthly, or if it's a really critical case, a 3-monthly check. Everyone always worries about side effects of every drug. And I don't think that's I think that's been shown more now than any other time. And I think it's really important to consider what is significant and what isn't, and what the risk-benefit ratio is. In this case, in Persen's case, the most likely side effects is inappetence or lethargy. And that's normally going to only occur after initiation of treatment or following a dose increase, so when you've gone up from 1 to 2 tablets. And usually it resolves within a few days of discontinuing therapy or dropping back to your previous level. And so it's really not too much of a concern. You can then restart the treatment or increase gradually and slowly over another week or 2, and most horses don't bother about it. This is where the company who created Percent looked at all potential side effects that were seen. And this is a list of a huge amount of diseases. And what's really important is actually this list isn't significant. I don't see any of these things in horses, but I think it really plays into what's going on at the moment is that most of these things would have happened to those horses irrespective of whether they were given Percent or not. And so actually those risks to me are null and void. And so we carry on with Percent because the biggest risk is decreased appetite. But what do we do if there's a poor response? Excuse me, we can increase our per dose of pergolide, and we can go up to about a tablet per 100 kilograms without any problem other than to your wallet. And the one thing is, as I said, whenever you increase the dose, you have to assess it. So you need to make sure that you are getting the response that you want. So recheck in a month's time. Hyperesthesia, the serious clinical signs only occurred at very, very high levels of the drug. So the doses we're talking about really aren't significant, and we don't have to worry about the high risks. The problem is the high risk to your wallet. The other thing is that sometimes it can be a temporary dose increase. So sometimes we can just increase it in the autumn period when we're really struggling and then drop it back down when we've got the quiet period. Now that does require more testing, more involvement from your vet and from yourself, but it is something that can absolutely be considered. And the other option is we can start doing things like splitting the dose twice daily. So often we'll give it once a day. There is some evidence that some horses have a very short half-life of the drug, so going twice a day can help. But that is completely off license and should only be done with the guidance of your individual veterinary surgeon. I mentioned Vitis castus because it is everywhere. You know, there's plenty of advertisements. There's only one independent study looking at this as a supplement in these cases. 14 horses were treated with it. Only 1 out of 14 horses remained stable. 9 actually deteriorated and were changed to pergolide, of which 8 then improved. There were no controls either. And actually some horses had an increase in their ACTH and an increase in their insulin whilst these studies were going on. And if you think about it, if there's any chance that you're going to increase the risk of hyperinsulinemia, and actually it's not making any difference whatsoever, this product would not be appropriate. In fact, it would absolutely be you wouldn't ever put a horse onto it. I would never advise it. So that hopefully is most of me talking. Sorry, I think I've gone a little bit fast, but it's always difficult watching a webinar anyway. But I was throwing some curveballs questions before all of this started, and I think they're quite difficult to answer. So the first two, can gut health be improved to reduce the risk of laminitis, and is there a link between ulcers and laminitis? I think we know that the bacterial population within the gut is absolutely critical to human health and equine health. We've seen more and more data research coming out that links not only our gut bacteria with diarrhea, with heart disease, but also with mental illness. So I don't for a second question that the gut microbiome will have a significant role in laminitis at some point. But at this moment in time, there is absolutely no scientific evidence, no differences between them. And so to advise on what you could do to improve it would be very remiss of me. Is there a link between ulcers and laminitis? I think there was also a subsequent question in that question about dietary modification. As far as I'm aware, there's no scientific link between ulcers and laminitis, but you know, pain can lead to laminitis. So pain can lead to ulcers. So pain could lead to laminitis, could lead to ulcers. And whether, again, your disruption of your gut microbiome could have a secondary effect, who knows? The last question that I was given before was winter laminitis, not frosty grass. People know about frosty grass and the differences in the sugars that are present there, risks of high absorption and things like that, rather than the cold weather. And actually, counter to what I think this person was questioning me about is that actually in many American states where there's a lot more snow and a lot more cold weather, is very protective for feet rather than counterprotective. And you know, the feet are magnificently designed to be able to switch blood on and off so that they don't get cold or they don't have any problems. We have seen a spike of laminitis recently in the last few months at the hospital. And in all of those cases, I can categorically say that as soon as we dealt with the diet that was being given in the stable, they fixed, or their insulin levels had fixed so that they could slowly get better. So I think, again, we're looking at a disease of intensification, that a lot of these things are caused by us and our dietary changes and not allowing these horses to get skinny as the winter goes on. So that is it, really. So what we know is that laminitis, an excessive level of insulin, triggers laminitis. And that insulin excessive levels can be caused by PPID, can be caused by obesity, can be caused by genetic potential. But the fundamental fact is that to fix it, we need to get the weight off the horse and we need to control the diet. ACTH can be tested for free through the Talk About Laminitis scheme, and so we can still diagnose Cushing's quite easily. So always talk to your vet about that, and also go on the Talk About Laminitis website, which has a huge amount of information about that and is very well documented. And the excessive weight can be controlled if the owner is motivated, and that is the critical thing, that the owner has to be fully involved in all of this. So that's me done, and I think we'll hand back over to Tracey, and then I think questions afterwards.
Yes, that's right. That's lovely. Thank you so much, Jamie. That was absolutely fantastic. I don't know if you saw pop up in the chat, but somebody said that you were so clear and explained everything in such a way that was easy to understand, and I couldn't agree more. Your advice there was really clear and lovely. So whilst I find my presentation and share my screen, hopefully, as long as the computer gremlins don't get me. My name's Tracey. I'm one of the Dengie nutrition team. I've been with the company a number of years now, so 15 years. And I have a degree in animal science and behaviour and a master's in equine science. So what I'm going to be talking about this evening, or my topic, is what can we do to reduce the risk of EMS and laminitis? And some of this will very much overlap with what Jamie's already said, but perhaps I just put a little bit more substance or structure to it as well. So as Jamie's already discussed, the latest consensus statement on equine metabolic syndrome said that EMS is controlled mainly by dietary strategies and exercise programs that aim to improve insulin regulation and decrease obesity where it is present. Now, translated, that basically means from a dietary perspective, what we need to do is to maintain our horses and ponies at a healthy weight and manage their intake of sugars and starch, as these factors influence insulin sensitivity and therefore laminitis risk. Now, whilst these things are kind of quite clear on paper, in practice, for us as horse owners, you know, sometimes that can be quite tricky to achieve and certainly very confusing. So for my presentation, I wanted to very much look at practical dietary advice and answer questions such as what should a healthy weight look like, how to deal with obesity, and what is low sugar, how low is low, and how do we get there. Now, some of my practical experience does come from my years at working for Dengie and with various horses that I've worked with during that time, but it also comes from some very personal experience as well. And I'd like to introduce you to Kizzy. I will bore you a little bit more with details about Kizzy as we go through, but I took ownership of Kizzy in 2013, but I've known her for a lot longer. She is 31 years old now. Initially, her previous owners actually purchased her as a companion, and she came from a riding school that was unfortunately closing down in 2004. So she went to a new home as a companion. And unfortunately, as is sometimes the case with these older horses, you know, her exercise decreased, her grazing perhaps increased because of her change in lifestyle. And over a period of time, she probably got fatter. And by autumn 2009, she had her first, or what was believed to be her first bout of laminitis with rotation in her right fore. PPID and EMS were latterly identified. So unfortunately, she does have the double whammy and requires an awful lot of management and sleepless nights on my part. The picture here was taken a couple of weekends ago. You can see her in all of her finest winter coat there. But as I say, I will chat a bit more about my experiences with her as we go through. So the first question that we'll approach is, what should a healthy weight look like? How do we identify obesity? And this has already been discussed to some degree. So the first thing that we can use for monitoring purposes is body weight. As Jamie said, digital scales are going to be the most accurate way to do that. But unfortunately, not everybody has the ability to take their horse kind of off the yard to go and get digital scales, or to have them come to the yard. So actually, whereas a weigh tape isn't accurate, from the point of view of monitoring change over time, it can be a very useful tool for us. Just a couple of things to consider. If you're using kind of a weigh bridge, or the tape for that matter, try to do so a similar time of day. There can be huge weight changes morning to evening according to what a horse is eating. When it comes to utilising a weigh tape, try and kind of be consistent. So you want the horse stood square. It is a slightly diagonal measure from the lowest point of the withers to behind the elbow, and try and make it the same person kind of doing it each time. And as I say, that will build you up a picture kind of over a period of time, even if it isn't as accurate as utilising a weigh bridge. But from having weighed horses on a weigh bridge, following kind of a weigh-in session, there's often two questions that I'm immediately going to get. Is my horse's weight correct, or what should my horse's weight be? Now, to answer those questions, it's fair enough to have a weight on a scales, and it's really useful for monitoring weight over time, but it doesn't tell us about the level of fatness. So to answer that question, we need to look at something called fat scoring, or you may also see it called body condition scoring, as well as that time. Now, there are different systems for fat scoring or condition scoring. There's a 0 to 5 scale, and there's one that goes up to 9 that is more detailed. Fundamentally, it doesn't matter which one you use, as long as you use it kind of more consistently. And the one kind of that's the 9-point scale, as I say, just has a bit more detail to it. Now, with fat scoring, it's very much a hands-on process. So we're not kind of just looking at the horse, we're actually feeling what's going on. And fundamentally, we're feeling for how much of the horse's skeleton that we can feel. The leaner the horse, the more of the skeleton you feel. The fatter the horse, the more you will struggle to actually get to that skeleton. So on this particular chart here, a condition or a fat score of 3, a moderate, on that kind of fat score, you will be able to feel the horse's ribs but not see them. But if they are a 2, so leaner, then you will be able to see kind of the ribs at that stage. So there's subtle differences between each of those points on that fat scoring system. Now, having said it's a hands-on process, I'm now going to be slightly mean and ask you to just have a think for a second. Who do you think is a healthy weight in these pictures? So I know I just said it was hands-on, but I'm asking you to have a look at a picture and just have a quick think about who you think is a healthy weight here. Now, in times gone by, when I've done this presentation where I've actually been able to see people, most people would actually tell me that they think A is the healthy weight. Now, that might be completely different for this audience, who are obviously much more clued up about laminitis, but A is an overweight horse. So we've become more kind of conditioned or accustomed to seeing horses that aren't kind of lean as being kind of a good weight. So horse A is very definitely carrying more weight than it should do. Now picture B, as you can see, that's Kizzy again, but this time she's got no coat, and you can see kind of the outline of her ribs on there. So technically that puts her portion of that part of her body at a leaner condition score. However, her rump or her bum is still very much a 3. Now, what we want to be not frightened of is actually seeing some rib, particularly at times of the year such as now, when we're coming out of the back end of the winter, because if your horse is leaner at the end of winter, you have more wiggle room for them to gain a little bit of weight in the summer and then hopefully lose it again the following winter. Horse C is about a 3. It's roughly kind of moderate, and D is more typically what you would associate with a horse with EMS. So you can see the cresty neck there, you can see the fatty pads across the back and along the bottom as well. So definitely C is a healthy weight, and B as well. A and D are carrying more weight than they should. Now, with that information that you gather, we want to be doing it regularly. So we'd recommend at home utilising a weigh tape every week. Obviously, if you can get to a digital weigh bridge as well, then great, to do it as often as you can. When it comes to fat scoring, probably do that on a monthly basis. Not only that though, we all love taking pictures of our horses and ponies, and that can still be a useful measure for us to reflect over a period of time how they're doing with their weight. So if you take a side-on picture and one from behind as well, and then you can save those and compare them across a period of time, you can get an idea as to how your horse's shape is changing weight. And I find that particularly useful when you are actively trying to promote weight loss. With the weight record that you have, again, if you can plot that on a chart, then it will give you a visual as to what's going on. So this graph here just shows seasonal weight change in 4 horses that I happen to weigh quite regularly. So along the side is the horse's weight, and along the bottom is some summer weights and winter weights across 5 years. So it's the end of the summer and the end of the winter that those points in time are taken. Now, there are 3 horses on there that I'm not worried about at all. And there's 1 horse on there that I am worried about, and it's not the obvious one. So I don't know if anybody would like to have a go at saying what they think is actually happening with the horse C, which is the grey line. If you want to pop that in the chat, please do. So I'm not worried about C, but there is one there that I'm worried about. And the one that I am worried about is this one here. It's actually horse B. Now, you obviously don't know kind of this information, but horse B, starting in that year 1, was actually already carrying too much body weight. You can see that then in the winter they lost, and then the following summer they gained, and then they lost, they gained, etc., etc. So they did have a bit of a seasonal weight loss, weight gain thing going on. But this particular year here, they've actually gained weight over the course of winter. So they are then coming out of winter heavier than they went into the summer the previous year. Now that's of concern, because if that horse continues to gain weight year on year on year, then they're going to become increasingly obese, and certainly in those that are predisposed to it, that could then increase the risk of laminitis. For the other kind of 2, so the yellow one, which is horse D, and the blue one, which is A, wasn't worried about their weights. Horse D was one that did need to lose weight, and you can see there are seasonal weight gains and weight losses, but there's weight loss over a period of time. And horse A was actually one that was far more kind of restricted, so it did need to lose weight, and then its weight was much more constant over a period of time. The one that I said was another one I wasn't concerned about, even though the line is going up really high, horse C is actually one that's growing. So that's gaining weight because it's actually also growing as well. So that just gives you an idea of the kind of picture that you can build up if you take kind of your weights regularly and then monitor them over a period of time. So from my perspective, kind of one of the other questions that I'll then get if we've established that the horse is carrying too much weight is how long will it take to lose that weight? And it's been suggested that a weight loss of 0.5 to 1% of body weight per week is realistic. So based on this, if we take the 0.5% of body weight, which is probably more likely in the setting of your own stables rather than research or kind of a hospital environment, then from the point of view of a 500 kilo horse at 0.5% weekly, it's going to take about 22 weeks or 5.5 months to lose 50 kilos in weight, or if it needs to lose 100 kilos, 11.5 months. Now, partly that information there on the number of months is probably a bit fictitious, because if any of you have ever tried to lose weight, you'll know that you tend to start off by losing a bit more weight to start off with, but unfortunately as time progresses, then that weight doesn't seem to come off as quickly as it once did. So the main message that unfortunately I wanted to get across here is the fact that weight loss is going to take some time. You are in it for the long haul if you've got a horse that needs to lose weight. The weight didn't go on overnight, and unfortunately it's not going to come off overnight either. The other issue, and don't be disheartened by this, is that actually using body fat scoring is going to take some significant weight loss for you to notice a change in that fat score. Kind of by our estimates and what we think happens, it's about 20 to 30 kilos for a half a change in fat score on the scale that we use. So it is going to take some time before you really notice a difference. But in my opinion, that's where taking those photos can be really helpful, because you might start to see, you know, some changes in shape that you wouldn't otherwise notice if you didn't have those photos to reflect on. So as I say, kind of from the point of view of weight loss, we are in it for a long haul, and it does take a long time to deal with. So case in point, back to Kizzy again, just to share what happened with her. So the picture at the top, January 2010, was before she was in my care. Didn't have a weigh bridge at that time, so it was a weigh tape weight that the owner had, and that estimated her at about 320 kilos, but she was probably heavier. Her fat score there is definitely on the very high end of the scale. You can see there's creases in her neck, kind of creases down her back, and she's very kind of chubby indeed. When she got the kind of laminitis, her owner obviously took the decision that she definitely needed to do something to sort Kizzy's weight out, and she followed the recommendations to the letter. And you can see by August 2010, you know, having taken those recommendations on board, Kizzy is already looking quite different. She's still carrying more weight than she needs to, but you can definitely see from that image that she has lost weight. Coming down to July 15 was when she was with kind of me. She was still on some grass access at this time, so her weight had picked up over the summer. What you won't see in that picture, but what was of concern to me, is the fact that unlike some other horses with EMS, Kizzy doesn't particularly have a cresty neck, but where she's more likely to get fat pads is actually on her rump, so her bum. So that's a particular area of concern for me when I notice changes in there. And then obviously you can see her there in that last picture at her lighter weight that I try and maintain her around now. Now, with that first picture I showed of her with her kind of full-on coat, you probably thought she looked quite chunky, but I would like to reassure you that what I'm feeling underneath is much more like that June 19 picture, perhaps even a little bit less. So there are changes over time. So that was her kind of story and her weight loss journey. And as you can see, you know, in that picture there, we're kind of 9 years difference. We've done it over a long period of time. Initially, there was a lot of weight that come off to start with. So how do you actually deal with obesity if you have a problem kind of with it? Well, in terms of kind of what we need to do, we need to manage calorie, sugar and starch intake to promote weight loss and also reduce laminitis risk in those that are susceptible to it. Now, I can find many people become very fixated on the bucket feed, when in fact most people that come to me on the whole aren't actually feeding that much in the first place in the bucket. There are exceptions to the rule, but on the whole people are feeding kind of very little. Now, when it comes to the bucket feed, I find that people get very fixated on it because it comes with a very handy label on the bag or on the website to say how much sugar and starch in it. And some people kind of try and always go that little 0.5% lower, which obviously generally is important, but my point here is that if you do that and ignore the other two bigger pictures there, which is grass and conserved forage, then you do so at your peril, because they form the absolute biggest part of the horse's diet under normal circumstances. So yes, bucket feed is important, and we'll talk about that right at the end, but first and foremost I'd like to talk about the other two things first. So I'm going to start with conserved forage. As Jamie said, if you've got a problem with laminitis, then chances are, initially you're not going to be doing any grass at all. That is the recommendation. The point I'd like to make here is that hay isn't just hay, and haylage isn't just haylage. There are many factors that influence nutritional quality, including the calories and sugars supplied. So when it comes to nutritional quality of our conserved forages, things like cutting date or stage of maturity, the actual type of grass, the type of soil it was grown on, the environmental conditions or factors during kind of growth and cutting and drying, and also changes during storage as well. Now, visually, we cannot tell any of these things simply by looking at the hay alone. It is really important to get it tested if you can. Now, one of the myths that I would just like to put to bed here is, again, speaking to customers, some things that they often say to me is, oh, I'm feeding last year's hay, therefore it's suitable for my laminitis prone individual. Well, unless you've had it tested to know that it is, the chances are it might not be. So from the point of view of sugar, with storage, it doesn't reduce. So whatever your hay was when it was cut, baled, and once it stopped respiring last year, it will be the same sugar level this year. So time does not decrease the amount of sugar in your stored forage. On the other hand, it does markedly decrease the vitamin content. So there are differences. So don't just assume because you're using last year's hay that it's safe. You won't know unless you've had it tested and you know it is of a low level. So what makes different fibre sources low calorie? It's all dependent upon their digestibility. So we've got a range of different fibre sources here in this picture, starting with straw at the lowest end and ending up with sugar beet at the highest end. Now, straw has a very low digestibility. It contains lots of fibre, particularly as well something called lignin, which is indigestible to the horse, which makes it a great low-calorie fibre source. Moving up the scale, we've got hay, alfalfa and sugar beet, which increasingly become kind of more digestible because they contain types of fibres that are more digestible to the horse and therefore provide more calories. So we do need to think about the types of fibre that we're using in our horse's diet, and remember that hay isn't hay and haylage isn't haylage. Now, just to go into that in some more detail, we've got another graph here looking at the digestible energy provided by different types and amounts of forage for a 500 kilo horse at maintenance. So unfortunately, if we have to bring our horses off of grass in order to manage laminitis, and because we need to manage their weight, we cannot then just put them in the stable and generally feed them ad lib forage if it is of a good quality hay, for example. So the bars on this chart, the blue bars are the energy requirements for maintenance, so that doesn't change, and the orange bars are the digestible energy supplied by different types of forage in different amounts. So that first one on the left-hand side shows forage or hay specifically being fed ad lib, so to the horse's appetite. You can see that that provides them with way more calories than they actually need. You heard Jamie mention restricting to 1.5% of the body weight, and the reason for that recommendation is, on the whole, it brings the energy intake with average kind of forage back more in line or less than the horse needs. However, if we're clever with our fibre sources and include a type of fibre that is lower calorie, such as straw, in with our hay, we could actually feed a bit more. So to provide the same amount of calories, if we do a hay straw mix, then we come to about 9.4 kilos, whereas if we were just feeding that hay by itself, it would be 7.5 kilos. So we need to have a think about the quality of the forages that we're feeding, specifically the amount of energy that they are providing. Now this leads us on to the question, how much forage is enough? Now we don't exactly know what the fibre requirements of a horse are, but it has been suggested that their minimum forage intake should be 1.5% of their body weight on a dry matter basis. So as we've already heard, 7.5 kilos of dry matter for a 500 kilo horse. Now, this is important because fibre intake, as you're probably well aware, is really important for the health of the horse, not only its digestive health in terms of ulcer risk, colic risk, but also its behavioural health as well. The horse has evolved to spend as much time chewing as it possibly can. So they are very driven to do so. And I think it's a bit sad, if we have to long term really restrict their forage intake. Obviously, if we've got a real problem, we need to get that weight off to start, then reducing to the 1.5% of body weight kick starts that process, but it's not a long-term kind of strategy. When I suggest straw to horse owners, again, there's usually one question I'm fairly guaranteed to get is kind of what about ulcers? Won't straw cause ulcers? And that's kind of a popular thing that's popped up really. Where that kind of opinion, if you like, came from was from a survey that was done in Denmark looking at the incidence of gastric ulcers in a population of horses. Within that study, one of the things that they found was likely to result in a higher incidence of ulcers was feeding straw. Now, I have to say, it was straw as the sole forage source, so nothing else at all. We don't tend to do that here in the UK. And it was actually their bed that they were eating, and they had very little access to any other kind of hay at all. We don't really know actually how much they were eating either. So there could certainly have been other factors going on there. And in practice, we have used straw as part of the forage ration for a number of horses and found it really helpful because after all, from the point of view of ulcer risk, what's going to be worse? That horse stood for a long period of time with nothing to eat or having something to chew on. So I think I'd always rather give it a go. The recommendations regarding the amount of straw to use do vary, but 30 to 50% of the total diet has been suggested. Again, there are a couple of caveats that we need to consider when we're utilising straw. First and foremost, the horse must have good teeth. If they don't have good teeth, they can't grind it down well, and we do potentially increase our risk for things like colic, for example, so we definitely need good teeth. The other factor is straw must be introduced gradually. Horses actually alter their kind of chewing behaviour in response to what they're eating, and it takes a little bit of time for that to happen, and also obviously for their gut to adapt to it as well. So we start off with lesser amounts and gradually build it up over the minimum of at least 2 weeks in quantities, but if you are going to be using quite a lot, then I'd probably extend that to a month. The other thing that we need to think about, if we are having to restrict the amount of forage in order to keep our horses of a healthy weight or to get them to lose weight in the first instance, is we do need to try and make it last a little bit longer. We want to divide the forage into as many feedings as possible, but not only that, try to slow the rate of intake. And that could potentially be, in my opinion, significant to the effect of the insulin response as well. So if we can try and slow it down as much as we can, I think that would be a good thing. And there have been various studies now looking at the effects of small hold hay nets, double netting, things like dividing your forage between nets and putting them in different locations in the stable. They're all kind of useful things to do. Practically, again, what I do with Kizzy is really a combination of all of those things. So she does have small hold hay nets. She has it divided in different locations when she's in her stable. And I've also got a couple of those balls there that you can see in those pictures, those forage balls. I don't actually know that they reduce the speed of intake for her, but one of the things that they do when she's in her kind of bare paddock is that they encourage her to move around a little bit. Although I have to say, I have noticed that she's even getting a bit more sneaky with that, in that she's learned that if she doesn't agitate it too much, it doesn't move too far, and then she doesn't have to go as far. So don't always assume that they're going to expend a lot of energy doing things like that. So the next question that we often come across is, what is low sugar? How low is low? And how do we get there? So that's a real problem. And this obviously is very significant. So in terms of sugar, what are we actually aiming for? So there's been various kind of bits of information, and if you've done any reading around the subject, you will very often see hay with a low NSC content should be selected. NSC is an abbreviation for a non-structural carbohydrate term. And then further to that, you probably will have seen the figures of 10 to 12% on a dry matter basis being frequently cited. You might be interested to know that, as far as I can tell, the reference for those figures actually tracks back to a study in PSSM horses rather than those with laminitis. And what they found in that study is that hay with an NSC content of less than 10% did not impact the glycemic and then insulinemic response, whereas hay with greater than 16% non-structural carbohydrate content resulted in higher glucose and insulin response in PSSM horses. And not only that, was actually eaten quicker as well, which may have had something to do with it. So although that figure originally came from PSSM horses, it's actually persisted, and in research and clinical practice, it's those figures that are often given. Now, the only trouble is, this may also surprise you to know, that there isn't a universal kind of test or measure that is commonly kind of given or used between either research or kind of recommendations. So we just have to have a look at what we're looking at. And you may actually see different kind of references when you have things like your forage analysis done. So just to tell you about some of the differences between those and some of the kind of conversation, if you like, about their different uses. So you may see a sugar percentage, and sometimes that can refer to different things. So you will see a sugar percentage on our feed bags and also our website, and that is done by a method called Liphook, which has a 40% ethanol extraction. And what that's measuring is simple sugars and disaccharide, and maybe some oligosaccharide as well, of very small chain numbers. What that really tells us the most is the difference between molassed versus unmolassed feeds most consistently. So that tends to be used in feed. You may also find it on forage analysis, usually when you have kind of a basic NIR analysis done. So with NIR, if you see sugar percentage, it's usually a prediction of the amount of sugar based on this kind of total method. So that method, if it is NIR, it's not as accurate as these other two, which are done by kind of wet chemistry. So looking specifically at the other two, we have ESC and WSC as our options. So ESC stands for ethanol soluble carbohydrate, and WSC stands for water soluble carbohydrate. Now, traditionally, when we're talking about NSC, non-structural carbohydrate, it has been the sum of water-soluble carbohydrate and starch added together. Now, water-soluble carbohydrate is the combination of everything you'd find in an ESC analysis plus fructan. Now, that is your storage polysaccharide. And the reason why there's been some kind of argument or some questions about kind of the differences between these methods is that some people say, well, if you have two different sets of hay, and maybe you have an NSC result on one of them that's say 2% starch, 5% sugar and 5% fructan, is that actually better than one that is 2% starch, 8% sugar and 2% fructan? So it's about the differences in the types of sugar or the storage polysaccharide found within that water-soluble carbohydrate fraction. So for those people that are promoting ethanol soluble carbohydrate, they say that that is likely to be more significant for our horses and ponies that have insulin dysregulation, because all of the things that are measured in ethanol soluble carbohydrate are going to be broken down in the horse's small intestine and directly result then in an insulin response. With fructan, it's dealt with in the horse's hindgut and it's fermented, and it's much less likely therefore to result in that direct effect on insulin. But what we don't know yet, and I genuinely don't know the answer to this, is what effect large amounts of fructan actually have on the microbial population in the horse's hindgut, and whether there is any difference in those between EMS and those that are normal horses. The other thing that I would argue is, having looked kind of at this, then the recommendation when using ethanol soluble carbohydrate as part of the description for non-structural carbohydrate is that the figure of 10% is still used. Now, in my opinion, And again, I'm not an expert kind of as such on that, but are we actually looking for a lower level with for ethanol soluble carbohydrate if it can have more of an impact on the horse's insulin response? Now, I'm afraid, as I say, I don't know which is ultimately going to be the best test to use long term. As Jamie said, there's been huge advances in the last 5-10 years with regards to our understanding. So come back and ask me this question again in 5 years' time, and I may have a very different answer for you. We just don't know. So in practice, where does that leave you as a horse owner? Because I understand as a horse owner, this is really frustrating. You know, which one should I use and how much am I looking for it to contain? So what I would suggest is get an analysis done, pick which one you're going to choose, a VSc, WSc, whichever your preference may be, and see how your horse does on it. If you are feeding it to your horse, following those 10% rules, but your horse still has a problem, then perhaps you need to do something different. You might be looking for something lower. In terms of the kind of forage analysis that we offer, the laboratory that we use does actually do water-soluble carbohydrate and starch added together. And I've just put some data there about the differences that we've seen over the previous 3 years data. One of the arguments for ethanol-soluble carbohydrate is that you're probably more easily going to find a hay to feed because you're more likely to get figures under 10% than you are with water-soluble carbohydrates. You can see here, though, that we do have some levels of water-soluble carbohydrate within our analysis that are less than 10, and that was actually better in 2020 than it was in those previous years. But equally, you will see that there is a huge variation. So in 2018, the highest water-soluble carbohydrate that we saw was 35%, and in 2019, we had one that was even higher at 47.4%, but that was actually a sample from France. And it was actually also Timothy, which is supposed to be a lower non-structural carbohydrate grass, and it clearly wasn't. So that really shows you the importance of actually testing the forage and knowing what you're providing. You can see there on the whole, we don't actually see large numbers of forage samples for analysis. Now, people could obviously be using lots of other different services, but I think still on the whole, we don't test our forages as much as perhaps we should, because in part, it's not always practical to do so. You may not have a constant supply of hay available at your yard, and it can become very frustrating, which is why it's important to look at what's actually going on with your horse and whether they're comfortable or not. The other thing that's already been mentioned that we can do is to actually soak our forage. And that's a good idea. Again, the results, unfortunately, are highly variable. So one of the questions that people often ask is, how long do I need to soak it for, and what kind of degree of losses am I going to get? And again, I'll be quite cagey with the answer to that question because it is just so variable in all of the studies that have actually been done. So that first study there, I actually really like because it was the first study that actually mimicked kind of what horse owners did in practice rather than what happened in a laboratory. So they soaked hay for 16 hours. So for example, an overnight period with water at about 8 degrees. So tap water, and it was actually the cooler winter months in that instance. And it resulted in a mean loss of 27% with a range of 6 to 54. So you can see there's that huge range there. But 7 of the 9 hays, unfortunately, was still not below 10%, and it had nothing to do with what their starting water-soluble carbohydrate levels were. So the same group of researchers later did another study, and it seems like water temperature could also be significant for us. So with higher water temperatures, we're likely to get greater losses. So in terms of, again, kind of practical advice, from what I do soak Kizzy's hay because I'm there fundamentally on a 12-hour shift. So I'm there in the morning at 6:30 and I'm there kind of at night at 6:30. What I tend to do is soak morning for night and night for morning at this time of year. But come the summer months when it's really hot kind of in the daytime, then I will reduce that right down to about 4 hours. Firstly, because I hope that there will be greater losses. Secondly, I know what my hay is providing and that I'm largely in a suitable range. but also because, as Jamie said, that forage is going to smell and probably taste pretty disgusting, and Kizzy's not likely to want to eat it if it's been sat stewing all day in really hot water. So in the winter months, a longer soak is fine, but we probably do want to reduce it a bit in the summer. The other thing just to be aware of, and this probably isn't relevant to many of you, but if you are having to really take your horse down to that 1.5% of their body weight of forage intake, when we soak forage, we also get what's called dry matter losses. So you actually end up feeding far less than you think you are, which can really rapidly accelerate kind of the horse's weight loss, which is fine. It's what we want, but at very restrictive levels that can perhaps increase our chances of other undesirable problems like hyperlipemia, for example. So we just need to be a bit cautious, and if we're down to the very low levels, then the advice is just to feed that little bit more, so 1.8% of body weight. So hopefully you'll get to the point that you've dealt with the immediate kind of laminitis problem. You may have got kind of some weight off if you've needed to, and then inevitably the question comes along of, can I turn my laminitis prone horse out to grass? So this is the next question that we are going to focus on. So what's good and bad kind of in this picture? And I don't mean specifically about the picture, but more the environment of what's going on here. So there's numerous different things. So in terms of the good stuff, then in this picture, horses are doing what horses like to do, trickle feeding and chew time. They're moving about, they're exercising, which they're not going to do in a stable. They've got the company of their buddies, and from our perspective, it's quite an easy thing to do to turn them out in the paddock. From the kind of negative or the bad side of things, unfortunately, we have no practical way of knowing how much energy they're getting from that grass, or even how much they're consuming at any given moment in time. And not only that, there is an unknown and highly variable amount of water-soluble carbohydrate. It literally varies on an hour-by-hour basis. So these things make it really tricky to manage those that are susceptible to grazing just by turning them out. Now, grass is a big part of the obesity problem. You may have noticed I quite like a graph, so we've got another one here, but assume kind of this is a 500 kilo horse out at grass 24/7 and eating about kind of 2% of its body weight. The line at the bottom is the digestible energy requirements at maintenance. The green line is the energy requirements for light work. And then the gold line at the top is the amount of energy provided across different seasons, so spring, summer, autumn, winter. And these values are taken from our ration evaluation program, PC Horse. Now in the spring, you can see that the horse's energy intake when it's unrestricted grazing is well above double kind of what it actually needs. So the horse is going to gain weight. Looking at the amount of energy there kind of on spring grazing, so 11.5 megajoules, that is equivalent to something like a conditioning or competition mix. Now, you wouldn't let your horse into the feed room to help itself to a bag full of either of those things, but many of us are happy to turn our horses out to grass to essentially consume the same amount of energy or calories. So it's no wonder that horses gain weight at that time of year, and they'll continue to do so in the summer, and again in the autumn the energy intake is a bit higher than they need, and usually it's the winter months that you'll then see a dip in that digestible energy intake. And that's why on the whole, kind of horses in their natural environment would have a seasonal kind of weight gain in the summer and weight loss in the winter. And there is some argument that it's us preventing this winter weight loss, which is all adding to the kind of EMS problem. Just again, another kind of myth that I'd like to dispel here is I hear time and time again people saying that winter grass is dead and it doesn't provide any energy. I'm afraid it does, and with environmental changes and challenges that we are seeing kind of over recent years, the grass has definitely still been growing. So for example, the horses at my yard were kept in for about 6 weeks because we just had a lot of flooding and they couldn't get out. And by the time they were turned out again, the paddocks that they went back out onto looked very much like spring paddocks, even though it was still kind of the depths of winter. So grass is definitely growing kind of even in the winter months, and it does provide energy or calories to your horse. So don't assume that it doesn't. Now, I talked about horses there, but what about ponies? Ponies have actually been recorded consuming up to 5.6% of their body weight on a dry matter basis daily. So for a 200 kilo pony, this is 11.2 kilos dry matter, which equates to 56 kilos of grass. Do not underestimate how driven horses, and in particular ponies, are to eat grass. They are very determined to do so. So when it comes to the question of, can I turn my laminitis prone horse out to grass? There's a few questions that you really need to ask yourself. Firstly, is your horse showing any clinical signs of laminitis? If the answer to that is yes, then I'm afraid my answer would be no, and you'd also need to take the advice of your vet. Second question, has your horse lost weight if they were overweight? If the answer to that is yes, and you're getting there, that increases your chances of being able to do so. Does your horse have normal insulin sensitivity? If the answer to that is no, then I'm afraid it's a little bit like a game of Russian roulette, putting them out onto pasture, because it's so hard to know what might tip them over the edge. So you might need to continue to work on that. Again, the same answer would generally apply if your horse has had previous multiple laminitis episodes. So if they keep getting laminitis over and over again every time you turn them out to grass, there's something that needs to be thought about and reconsidered. The last thing to bear in mind is if your horse has been previously overweight at grass, do you have a plan in place to limit their grazing intake to help them manage their weight when they return to grass? So if previously they've been out just on an unlimited paddock with their buddies and have been overweight, if you do the same again, you're likely to get the same results. So we need to think about other options for managing these horses. And there are several different things, and I've not exclusively got all of them on here, and there are advantages and disadvantages to each one. I'm afraid none is kind of perfect, but they're probably the best that we have to work on in terms of actually managing grass intake. So we have an option of a no grass area. So for those where the insulin is just not under control, that's probably the safest place for them to be. We can do things like strip grazing and track systems, which aim to limit the amount of grass that the horse or pony has access to. And I apologise for the terrible pictures there. I don't have any good photos of those things, so I had to draw my own on the computer, so they're not very good. And the other option that we have is a grazing muzzle as well. So we'll just talk about a couple of those different options. So with regards to grazing muzzles, a study in 2005 found grazing muzzles restricted intake by 75 to 86%. That was actually my own research study for my master's dissertation project, because at the time I was recommending grazing muzzles frequently, but as far as I was aware, there was no research to show by how much they were actually restrictive or what effect they actually had on the horse's behaviour. So it was an area of particular interest for me. Later studies, I'm pleased to say, actually found a fairly similar thing, so a similar kind of range in terms of the intake compared to free intake. But the second study was actually really interesting, because during the 3-hour grazing period, those ponies without muzzles on consumed 0.8% dry matter of their body weight. So if they were kind of supposed to be dieting, they were consuming over half of their daily intake from that grass in that restricted period. So my case in point here again is, don't forget how driven horses and ponies in particular are to eat grass. They will alter their behaviour to consume more in a lesser time period. So for this reason, we don't tend to suggest restricting time at grass without taking other measures to limit the horse or pony's intake. There have been further kind of muzzle studies looking at using a muzzle as part of a 24-hour turnout period. So 10 hours with the muzzle on, and then it's taken off, and then the ponies are allowed to graze freely. They did find that it was effective for managing weight, but there was one pony, and there's always one, that did gain weight during that period. I would prefer not to suggest that as a method for managing the weight of those that we know are laminitis prone, because again, that compensatory eating, I think there'll always be some that are just going to gorge themselves as soon as that muzzle's removed. So that wouldn't be my favourite method. When it comes to kind of muzzle use, there are lots of things that we need to do. It does need to be introduced gradually. It's not going to be for every horse or every horse owner. There are some that simply don't get on with it and refuse to use it, no matter how much training you put in. But equally, there will be some that become very used to it and are perfectly happy to utilise the grazing muzzle. So Kizzy was that case in point, and actually it got to the stage where I used to arrive in the morning and pick her muzzle up to turn her out, and she used to stick her head in it straight away because she was so keen to get out in the paddock. But there's some, unfortunately, that won't get on with it. You need to make sure fundamentally that the horse or pony is happy to drink or eat with the muzzle on, and make sure that they're not being kind of bullied by others in the group, or even more unhelpfully that others in the group aren't removing that muzzle, because that can also be an issue. And as I say, I'd use for a maximum of 12 hours and then bring into the stable or no grass area. And we definitely want to make sure that the muzzle fits and comfort adapt if necessary. Now, there are kind of welfare implications of using muzzles. We've got to use them carefully, but I do think if you're on a yard where you have very little say over what pasture or paddock your horse or pony goes on to, and you're not allowed to use things like electric fencing, you can't develop track systems, etc., then they are quite a practical tool. And as long as they're introduced gradually and with a little bit of perseverance, then you can get there and they can be used quite well. Another option that we have is strip grazing. So there have been some more recent studies that have looked at strip grazing that have been really interesting. So Longland and Harris compared 3 grazing practices on managing body weight. All ponies had access to 1.5% of their body weight dry matter daily over 28 days. There were 3 different groups though. So one group of ponies had access to all of their daily 1.5% body weight all the time. So in other words, they were just in one big paddock. One group had a front fence and a back fence that was moved 1/28 of the paddock every day. And then the last group had just the front fence moved 1/28 of the paddock every day. So had increasing amounts of grass over a period of time. What the researchers found that body weight gains were significantly higher for those with free grass access compared to those that were stripped grazed. So they suggested that strip grazing was a kind of good tool for kind of managing these ponies' body weight. So that was really promising. Just from a practical perspective, obviously these researchers, you know, they cut their herbage, they weigh it, they estimate it based on the area to know how much the ponies are consuming. For us mere horse owners that are kind of got their horse at home in a paddock, you know, how little do we make that section? That can be the challenge. The other thing I think we need to think about when we're moving fence is also how regularly we do it, or how much we give extra at a time. If you suddenly open that fence up and they've got a lot to graze on, then that's going to be, you know, really quite a significant change in their diet. And also, again, if they're eating it very quickly, in my opinion, it could result in a bigger kind of insulin response. So my advice would generally be little and often for fence moving in that case. And in a way, a similar kind of thing would apply for kind of your track system as well. How effective that's going to be is going to be dependent on how much grass is on there as well. So it's not just calories though that we need to restrict with kind of our grass management, but also we need to watch out for this non-structural carbohydrate again. And as I say, it's very unpredictable. It's very difficult for us to know at any given point in time whether a pasture is safe or not for our potentially laminitis prone individual. Anything that encourages grass growth whilst reducing photosynthesis, which is the thing that makes the sugars in the grass, will result in lower levels of sugar kind of in that grass. So if it's nice and cloudy, or if the grass is kind of in a woodland, for example, that's shaded, if that grass is growing, then you should get kind of lower levels of non-structural carbohydrate. Conversely, any kind of time where the grass isn't growing, but the sun is still shining, we're going to get far higher levels of non-structural carbohydrate being produced. So generally, the kind of advice loosely is that we want to kind of keep the grass growing, either by regular kind of cutting or grazing. So you can even put other horses up a track before you send your horse behind, for example, if they're not going to be able to consume all of that grass themselves. The other piece of advice is to restrict grazing to the early morning and avoid the highest concentrations of non-structural carbohydrate later in the day. So turn out first thing in the morning and bring off the paddock by mid-morning, for example. We want to prevent access to grass at times of high light intensity and low temperatures. So generally the spring, autumn, or other conditions that favour slow growth. So what I'm talking about here is your kind of frosty, sunny mornings. Your sugar levels will be a lot higher. But it's actually a little bit more extensive than that not many people necessarily realise. From the point of view of what plants do, anytime the temperature is less than 5 degrees, they are not going to be growing. But if the sun is shining, they are still going to be photosynthesizing and accumulating that non-structural carbohydrate. So even if, you know, it hasn't been frosty overnight, if the temperatures have been below 5 degrees, chances are that pasture could be much higher in non-structural carbohydrates. So you definitely want to think about, if you've got a horse that is more prone to laminitis at this time of year, you know, maybe think about restricting the grass, you know, altogether kind of during that season. The other thing about a grazing muzzle is it actually physically reduces the bite mass and the rate that the horse can eat off and which part of the plant they're eating as well. So generally they are thought to be useful for that perspective too. Now, I don't want this to sound all kind of doom and gloom. I'd like to introduce you to Chewy. If any of you have looked on our website before, you've probably seen him, and if you've heard us do talks before, you've probably heard us talk about him. But we have a huge amount of data for Chewy, and he's really interesting. He's actually quite an old boy now. He's about 33, I think, and he's a 14-2 Connie Cross. He had his first laminitis incidents at 9 years old, with reoccurring bouts in 2010, 2011. Again, he had the double whammy, so EMS and PPID combined. Here's his kind of before and after pictures. So by 2014, he was 68 kilos or 10 stone, 9 pounds lighter, all due to his owner's kind of management of him. So she'd really managed the kind of grass. Now, Chewy does have access to grass. He still continues to have access to grass now. And this is his weight chart kind of over a period of time. Where you can first see that the weight is dramatically reduced, that is because he has been removed from grass and has been fed a controlled kind of or a managed forage intake. When you start to see the peaks and the troughs again in the graph is when he's then returned to some grazing. So as I say, his owner, Becca, is really careful about what she does with him. She utilises a grazing muzzle for his grass management. And basically any time the grass is long enough to poke through that hole in the muzzle is when she's going to be using it. There are some periods kind of in the summertime that perhaps he does have some access without a muzzle on when the grass is very short, but she's always very cautious. We've had a couple of years recently where we've had quite a lot of drought, and the time that she'd then need to be cautious is when it then starts to rain again, because you'd see significant changes in the grass at that time. But as you can see, Chewy's kind of lost that weight and over a period of time has kept it off. He usually hovers around the 400 kilo mark, give or take 10, but you will see towards the end of the chart there was actually quite a big dip in his body weight there, and he'd actually had some dental issues. He was struggling to chew his forage and he'd lost weight. Once that was sorted out, he's back to the status quo, and I hope to get to weigh him again really soon as I can to see how he's continuing to do. So the last thing that we're going to talk about is what about bucket feed? So I said, you know, it's those other things that really are important for managing these horses and ponies, but invariably we're going to pop something in the bucket feed as well. So the first step, you know, if you have got something that has laminitis, we're going to get rid of any unnecessary extras. So a handful of this or cup of that, it all adds up if the horse doesn't need it. And I don't know if you know, but half a stub scoop of high fibre cubes provides almost as much energy as a kilo of hay, depending on the quality of the hay. So what's going to keep the horse chewing and occupied for longer is going to be that hay. So that is much better to utilise that. So we need to think about, why do we feed horses and ponies if their energy requirements are met from grazing or conserved forage alone? You know, why do we actually want to feed them? And it's for this reason here. So again, this is a chart from our ration evaluation program PC Horse, where we can input what the horse is eating, and it tells us how that compares to their nutritional requirements. So this particular horse here is one that is being fed 1.5% of its body weight. It's a restricted ration of hay only. Anything in red is outside of the optimal range. So the first thing that you can see there is lysine. Now, lysine is one of your essential amino acids. It's the one that we know that there is a requirement for, and it's limiting, and it's one of your building blocks of protein. So generally for horses that are on kind of lower calorie, lesser quality hay that's also restricted, they are likely to be missing out kind of on lysine, but the more grass that they have, the perhaps less likely that's going to be. Looking down the list, you've also got things like copper, zinc and selenium, and even in a horse that is on as much grass as it wanted to eat would actually be deficient of these nutrients within the UK. So these are things that we generally always look to supplement, regardless of whether you're restricting the horse or not. The last thing on the list there is vitamin E. So if the horse is in the stable all of the time, under normal circumstances, grass would be the source of vitamin E in the horse's diet. And the more that they're stabled, the less grass they have, then the more likely they are to be missing out on that nutrient. So given the dietary shortfalls in UK pasture and forage, all horses and ponies need supplementing with an additional source of vitamins and minerals. And this can be provided in the form of several ways. So we've got options like a supplement, a balancer, or a feed fortified with vitamins and minerals. So what's the difference between those? So just picking 3 products out of the Dengie range that are doing a similar job, if you like. We have a fortified feed, a balancer and a supplement. The biggest difference you'll notice between those 3 is the feeding rate. So the fortified feed is 2.5 kilos, the balancer is 500 grams and the supplement is 60 grams. Obviously, from the point of view of calorie intake, your supplement's going to provide the least amount of energy, and you can see that at the bottom of the table there. Obviously, your supplement's probably going to have to be fed in a handful of something. You're not likely to feed it on alone, so you will get some calories from that. Now, if you were wanting to use the fortified feed as part of your weight loss management regime, you would have to include that as part of your 1.5% or more of body weight, because otherwise we would be adding in extra calories. The other thing that's different between these 3 products is the lysine at the feeding rate. So actually the fortified feed and the balancer are fairly similar, but in the case of our powder supplement, it doesn't really provide any appreciable amount of lysine at the feeding rate. So the question comes then, when would you use one or the other? We'd generally go with a vitamin and mineral supplement if the horse has a decent amount of grass, or we know that the forage is good. Or we're feeding it alongside something else that supplies kind of good quality protein. But failing that, for most horses where we're restricting their intake, probably soaking their hay a lot as well, we generally go down the balancer route. However, there is something else that you need to think about as well, and that's probably to seek product advice from whoever company that you're actually using to feed your horse, because products are formulating, it's based on a number of assumptions. So all of those previous products are based on the assumption that your horse is probably having some access to grazing, and the less access to grazing that you have, then perhaps further away from providing those nutrients certain supplements might provide. So just as an example of that, again, Kizzy bucking the rule, despite the fact that she's an elderly pony, that's certainly not a performance horse, she is on performance vitamins rather than the leisure vitamins, and that's because this particular supplement at the moderate work rate provides a higher level of vitamin E, and that's what I needed in order to balance her ration. So just bear in mind that those on restricted rations may require higher specification feeds, supplements or balancers to ensure that they are getting the nutrients they need when everything else is restricted. And that's something that we can certainly help you with on an individual basis. The last factor, obviously not dietary related as such, but is definitely more energy out. So exercise increases energy requirements, creating a greater energy deficit. But in practice, you'd have to be really doing an awful lot of work without dietary intervention to get the horse to lose weight. And most of us, if we're honest, don't do sufficient in order for that to happen. But there are more benefits to exercise other than just that. And there is evidence to suggest that exercise combined with weight loss increases insulin sensitivity. So in that study, I think that's where the 15 minutes of trotting came into the equation, and obviously some cantering as well. Not only that, we definitely want to be using the colder months as an easier time for us to encourage weight loss in our horses and ponies. And that can be achieved additionally by avoiding too much thermal protection. So again, it's probably something you've heard of time and time again, but try to avoid over rugging your horses or ponies, or perhaps consider if they need one at all, especially when they've got thermal protection if they do come into a stable at night time. It's honestly the easiest thing that you can do to give yourself a bit of a break, encourage some weight loss, but you don't have to have too much intervention. Obviously, if your horse goes out in the paddock and you want to be able to ride them later on, then you might still want to put a lightweight rug or something on like that, just in case they come in doing their best impression of a hippopotamus, and then you can't kind of ride them. Now, I told Kizzy about this 15 minutes of trotting, and she said, "Are you having a laugh? I'm now 31 years old. I'm not going to be doing this 15 minutes of trotting." So the other message really is just to do more than you did before. So obviously, Kizzy is no longer a riding school pony. I am definitely too big to ride her. And there aren't any kind of children that kind of come to ride her. Her behaviour can be a little bit unpredictable. I think she used to do a lot of pony club mounted games, which she loves, and she's also called Wizzy Kizzy. But the thing that we do is just try and find something that you enjoy doing. So if you can't ride them, or even if you can ride them, but perhaps you're not too confident, find something you can do to increase your level of activity. So I've tried kind of numerous things with her over the years. I did do a bit of ride and lead, but I was too scared to go anywhere other than the menage to do that. But that meant we could do more trotting. But the thing that I enjoy kind of most frequently, and she enjoys as well, is actually just walking her in hand. I'm really lucky where I am. I've got access to lots of off-road tracks and the seawall, etc. And I can get out and about with her. The people on the yard actually often joke conditions have to be Kizzy compatible, and that is beyond the truth. The weather has to be good and the stars have to be in alignment, and then she loves it. But if she doesn't love it, then she certainly lets me know about it. So work with what you've got and try and do a bit more if you can. So in summary, how do we reduce the risk of EMS and laminitis in our horses and ponies? We have to manage them. So we have to monitor their body weight, their fat score, and for signs of laminitis, because these are all things that tell you how well you're doing with the plan that you're on. We have to adjust. So we have to adjust their intake based on the above. So as I say, if your horse isn't losing weight, we might need to feed a bit less or change the type of forage that we're using. If your horse still has sore feet, we might have to seek something that's lower sugar or soak for a bit longer. We're going to have to note everything down. So note your weights down, even note your dietary changes down. All of these clues can help kind of in our understanding of the problem. Ask for help. So ask for help from your vet, your farrier, your nutritionist, and your yard. I couldn't personally, still with my job under normal circumstances, manage Kizzy without the help of all of these other people, and especially from my yard. They have been absolutely brilliant. They are there all day, so they're able to put hay nets in across the day for me, and they also built Kizzy a no grass area, so a wood chip paddock, when I could no longer turn her out because I couldn't keep her comfortable. Get your forage tested if you can prior to purchase is my G. And then lastly, my E. It was going to be exercise, but I really thought that there should be enjoy your horse or pony there, because sometimes this can all be a bit of a gloomy picture. But actually, if you can get things changed, find something that works for you, you still do have time to enjoy your horse or pony. And there is nothing better than when they are sound and comfortable and a good weight to know that you've achieved that. That really is something. So I hope that was interesting. Just from the point of view of any of you want personal feeding advice, then we're probably not going to do that tonight, but you can contact us on the website, dengie.com, the contact us section, and you can fill in a form with all of your horse's details on there, and we can come back to you. So I think that's me done. Jamie, would you like to come back on camera again and pop your sound on, and we'll see if what questions we've got. I've got some that from your talk already. I might have to have a bit longer to sort out for some of the others that have come in, so bear with me.
I've been keeping an eye on it, so hopefully I've got a summary of the questions as well. So hopefully I can nail a few of them fairly quickly.
Yeah, that's it. One of the first ones of the questions, there was lots of really great questions, by the way. Thank you very much. They were really interesting. One of the first ones I'd like to ask you, Jamie, is can horses neglected as foals develop insulin dysregulation? So do you think there's more of a chance if they've been neglected as youngsters that could change things later in life?
I don't see why it should, because insulin regulation is more often than not associated with sort of disease of intensification, you know, the diets, the feeding that we give them. So I don't think neglect should increase the risk. Obviously, you know, you go back to the microbiome question, could there be an impact there? And absolutely, I would categorically say there probably is some sort of impact, but I wouldn't want to hazard a guess as to what it is.
Yeah, okay, fantastic. There was a question about, from my perspective, one that I'm going to answer, is the effects of steaming and sugar losses in hay. So the effects of steaming is a fantastic thing to do in terms of the hygienic quality of your hay, but you don't tend to get as great sugar losses. Now, the reason for that is with our water-soluble carbohydrates, you need a volume of water there for that sugar to kind of leach out for. With steaming, you only use a very kind of small volume of water, so you don't get those losses to that big degree. There's no harm in you combining both, though. If you want to soak it and then steam it, then you've got something that is of nice hygienic quality by doing so. So by all means, do that, would be my opinion. Next question, I think, Jamie, for you, if you don't mind, is ulcer-prone horse who is fat, would you be more concerned about getting it to lose weight than be concerned about ulcers? And I think this is a common question.
It's a really difficult one, isn't it? And I think it's you know, I was very interested in your straw conversation. It's not something I particularly do very often, and I think somebody mentions concerns about impactions in their questions, which you know, I think your very gradual introduction of straw should hopefully alleviate. And obviously, you'll be always recommending making sure the dental work is good and it's all mixed up well. I think there are ways and means of doing it. You know, you could do a prophylactic treatment for your ulcers. So in other words, keep a very low level of Gastrogard going in whilst you're on the strict diet, so that hopefully you don't allow ulcers to occur. But also it's trying to, you know, trickle feed so that they're chewing, they are constantly having access, because it's not so much the volume of food, it's the fact that every time they chew, they produce saliva, which is a bicarbonate, which buffers your stomach. So there are ways and means, and it's tricky, but you can absolutely manage it with some guidance from your vet or nutritionist.
Yeah, absolutely. And I'd certainly add to that, it's about the period of time that they're without something that's probably going to be significant. So if you can restrict to a level so that they're not more than perhaps, you know, 4 hours without something to eat, then you're probably going to be winning a little bit more. There were periods, obviously, when Chewy, who was in that presentation, and Kizzy, who was in the presentation, you know, they have been on 1.5% less, you know, or sometimes even a bit less of their body weight, but they haven't had an issue with ulcers, with the exception of Kizzy, where she did have them. And actually that was when her hormones weren't quite under control, and she had kind of a little bit of an attack of laminitis at that stage. She was kind of footy rather than kind of complete rotation at that stage, but she did then have an attack of ulcers. Now you have to think, well, there's a pain element to that as well that's going on. So I think we're managing everything kind of all together is the important thing. There was one other question that I felt was really fantastic, because unfortunately we have marched on time-wise a little bit, but when is it safe to introduce exercise? Should you walk a horse with laminitis?
Yeah, I saw a good few of those questions coming through of when and how to do it. And I think primarily, obviously always talk to your vet. That's number one. So please don't take my advice to mean what is right for all of your horses. Any horse that is currently laminitic is showing pain associated with their feet. No, they should not be exercised in any way, shape or form. And critically, I normally wait a good few weeks after resolution and complete soundness of that horse before I start introducing exercise. Obviously, that depends on how long and how severe everything has been. So no, you are completely reliant on your diet during a laminitic episode with no exercise.
Yeah, okay. A couple more questions for me here. There was a question about grass length. Is it safe to turn out on long grass? The trouble with long grass is that if it's not restricted in any way, they could still be consuming a big volume of it. So you've got a calorie issue there, but also potentially a sugar issue there, because they could be consuming a lot. So that is the kind of issue with kind of long grass, is that you just don't know how much is going in. And that's where kind of your regular cutting or grazing or mowing ahead of that kind of particular horse or pony going out is probably kind of really what you want to be doing. Another question was, does work counter the effects of spring grass? Probably not sufficiently. You'd have to be working quite hard, would be my general answer to that. If you suddenly fancy taking up racing, 3-day eventing or polo, you might stand a better chance of that being the case, but it would have to be a lot of work. So usually, and again, this is the same for humans as well, you know, generally you need dietary intervention and exercise for weight loss. Just generally, if you're just going to do exercise, you probably still won't get sufficient weight loss, would be my opinion.
I think, Tracy, can I just add one more thing into that comment, is that, you know, from a calorie point of view, that's one thing. You know, you may be able to maintain spring grass with lots of exercise, but from an insulinemic point of view, if you're getting high sugar food, you're still going to, irrespective of your level of exercise, until you get a very fit horse, you're going to still going to get these hyperinsulinemic spikes and risk of laminitis. So
yeah,
if your horse is at risk, be very wary of that fresh grass.
Definitely, and that's fundamentally the problem, isn't it? We just, you know, can't tell what it's going to be, and then how quickly they're going to consume it and what effect that's going to have on their insulin either. There was another really interesting question for you here. Will all horses develop PPID with age?
Really interesting question. We know that, I'm going to really stretch my brain, 20-something% of horses over 15 have it, and it just gradually gets better, higher and higher. But no, there are plenty of horses that do not have clinical PPID, and plenty of horses that I think are borderline. So no, not every single horse gets it at all, and you know, you should test based on your clinical concerns, really.
Yeah, absolutely. That's fantastic. I think there was a lot of questions that we did answer there. Somebody did put, if you have a pony that always has a high response to a glucose challenge every time it is done, is it worth doing again if they're not overweight?
Yeah, I think it's yeah, that's one of the questions I noticed, and it's an interesting question, because I think there's a massive degree of frustration there, because, you know, you're doing everything right and you're not getting that insulin level down. I think the answer is, you know, you have a horse that is hyperinsulinemic and is at risk. The question, therefore, is, can you start returning that horse to a normal life? And I think that's where you start considering testing the diet that horse is on. So go back to those slides where I said, okay, let's do the new stuff. Let's go and feed your horse hay, test its insulin levels, great, normal, then turn it out at grass, whatever the result is. And you can really work with your vet to try and work out and formulate a plan as to what is reality and what can be done to get that horse to a healthy and normal environment. Yeah,
absolutely fantastic. Well, it's now pretty much 9:10, so we have gone on a bit, and we probably need to get away to bed. So I think, unfortunately, I am going to stop questions there, but as I say, if there are questions in the Q&A, which I can see there are lots, if any we haven't answered, we will do our best to get back to you with those. So all that remains for me to say is thank you so much, Jamie, for a really informative evening, and thank you to everyone that has listened. As I say, you will be getting a recording in the next kind of couple of days. I hope you all enjoyed it, and you obviously know how to contact us from the point of view of feeding advice if you want to. So other than that, I shall leave it there and say good night to everyone. Thank you very much.
Thanks a lot.
Bye.
Bye.